Good afternoon, everyone, and thank you for joining us today. A short disclaimer, the information presented here is for the purpose of informing the board. The views expressed do not necessarily reflect the views of the board or any board member. We are recording today's session. You will be able to access it on our website at ssab.gov. Questions and comments are welcomed and encouraged and can be submitted via the Zoom Q&A function or email us at events@ssab.gov. You can also tweet us using our handle at @ssabgov. Feedback is also welcome and can be sent via email to events@ssab.gov. And with that, I will hand it over to our board chair, Bob Junde.
Hi, everyone. Thank you for joining us today. On behalf of the Social Security Advisory Board, I'm pleased to welcome you to today's public session on researching and evaluating equitable access to Social Security programs. 3 years ago, the board began a long-term project to examine Social Security's service to the public. The board's first paper examined the impact of pre-pandemic local Social Security field office closures. As part of that work, the board met with one of today's speakers, Professor Pam Hurd, along with co-author Don Moynihan, to learn of the administrative burden framework, the costs people face when interacting with public programs like Social Security. The pandemic has highlighted the importance of examining how people access SSA's services and engage with the agency. The board hopes that today's conversation continues to further that aim. And with that, let me briefly introduce our guests. Full bios are available on the website, and our staff will link it in the chat. Dr. Pamela Hurd is professor at the McCourt School of Public Policy at Georgetown University. Professor Hurd's research focuses on inequality and how it intersects with health, aging, and policy. She was also an expert in survey research and biodemographic methods. Professor Hurd has received grant awards for her work from NIH, National Institutes on Aging, the Ford Foundation, and AARP. She has a book published by the Russell Sage Foundation, Administrative Burden, Policymaking by Other Means, which has received numerous awards, and I enjoyed. Hurd earned her PhD from Syracuse University in sociology. Next, Dr. Sebastian Hilke is an associate professor also at the McCourt School at Georgetown, where he co-directs the Better Government Lab. Professor Hilke's research applies behavioral insights to public management and policy to study how government reforms affect public employees and the people they serve, especially regarding equitable access to public programs. He is also affiliated with GSA's Office of Evaluation Sciences, where he works to design and implement large-scale randomized control trials with federal agencies. In 2017, he received the Beryl Redden Award for the best article published in the Journal of Public Administration Research and Theory. Professor Hilke earned his PhD in the Netherlands from Erasmus University, Rotterdam. Professors Hurd and Hilke will begin with a presentation. After that, we will welcome board and staff questions, followed by questions from the public. Please submit all questions and comments via the Q&A box on Zoom. Now to the presentation. Thank you for joining us, Professors Hurd and Hilke. I turn it over to you.
Thank you for having us. So I will go ahead and start, and then let me just get my slides going. Sorry, this always takes a minute. Okay, so I'm going to talk more broadly, and then Seb is going to focus on some more specific kinds of research. But broadly, what I'm talking about is addressing administrative burden in the Supplemental Security Income Program. Before I start, I do want to emphasize really important context for this is everything that I'm talking about on some level is directly a function of kind of administrative capacity, and specifically SSA's administrative capacity. And I want to say that in part because the agency has really been underfunded. So it has about, I believe, a 13% decline in funding between 2010 and 2021. Well, it's the increase in beneficiaries has increased by 22%. So a lot of the kinds of things I'm going to talk about, that the kinds of things that I feel need to be done to reduce administrative burden, is really hard to do when you don't have sufficient administrative capacity. And even the problems that we're seeing right now are in large part because of administrative capacity issues. So I do want to start there as really important context. Administrative burden I'm going to start with a story, actually. This is a story of someone who was applying for SSI for a child with a disability. So I applied for SSI per our genetic doctor's recommendation, and this is kind of an important point about how people learn about the program. He felt it was necessary due to our need to have Medicaid for my son's growing medical needs. Insurance wouldn't cover a lot of his healthcare costs. SSI denied him within 30 days, with all the medical documentation provided to them supporting the need. I was a young single working mother and felt so helpless at the time. Our pediatrician recommended contacting a local congressman. Our congressman contacted SSA on our behalf, and within a year, he was approved for SSI. And then she comments at the end, P.S. LOL, it should not have required congressional intervention to be approved for SSI. So she's definitely had a sense of humor about it. But I wanted to start that story as sort of context for how we might think about administrative burden. So these are the experience that people have and difficult interactions that they have when trying to access benefits like SSA. These are comprised of learning, compliance, and psychological costs. The learning costs, right, are her trying to figure, or her even knowing that this is a program that might help her. She found out from a physician that this is a program that might help her. Compliance costs, this is like the traditional stuff we think about, the paperwork, the documentation, things like that. And then the psychological costs, though, are important here too. You'll note she used the word helpless. Right? She really felt, you hear this over and over again when people talk about these experiences, helpless, frustrated, stressed, scared is a word that comes up frequently. So I'm going to highlight here key broad burdens in SSI, and these are burdens that we know as a function of like basic research, basically. So this is all supported with empirical evidence. So right, basic thing in terms of learning costs is just people having some sense of awareness that the program exists. And Seb's going to talk about some work SSA has done on this to try to improve kind of awareness of the program and thus improve enrollment. The compliance costs are quite large. So key factors that affect compliance costs are things like access to the field offices. There's work showing, for example, that the field office closures reduced by significant amounts enrollment in SSDI in counties most affected by those field offices. And really important to note that it was people with the least amount of education, the kind of most vulnerable beneficiaries who were least likely to enroll or affected by that. Proving disability for people who are not older adults is an incredibly onerous and difficult process. The asset test. Now, of course, this is a policy design element, but it also profoundly affects the burdens of experience that people have within the program. It's really difficult to understand. I mean, it's not just difficult to get on the program, but to stay on the program because you're constantly managing your bank account to make sure that your assets don't get too high to disqualify you for SSI. And we know from other programs, like SNAP and Medicaid, that asset requirement really negatively affects take-up. And then complicated applications, right? And this includes things like documentation. So those are some key burdens within the program. Turning towards how do we fix these things or think about fixing these things, it's really important to note that the Biden administration has made reducing burden in public programs a key priority. So they have issued multiple executive orders. One was effectively an equity executive order where they really highlighted reducing administrative program and burdens, in large part because they do disproportionately affect disabled people, people with low incomes, and racialized minority groups. They also issued, though, more recently, the executive order on transforming the federal customer experience and service delivery to rebuild trust in government. That's a mouthful, but right, like the idea is that they were really arguing here that programs, including programs, federal programs administered by states and localities, really need to take this seriously and need to start thinking about how to reduce burden. These are just some key highlights from that customer executive service order. I'm pulling this up in part to note two things. One, SSA is one of the agencies that's considered a high impact service provider. And there are requirements built into that executive order about repeatedly monitoring and building in strategic planning and performance processes to try to evaluate and reduce burdens in programs. One key element here and one thing that really resulted from these executive orders was that OIRA actually reissued guidance around a bill that already exists, which is the Paperwork Reduction Act. So the Paperwork Reduction Act roughly was intended to at least require agencies to document kind of how burdensome interactions with government were in their programs. The problem with how it was implemented in practice, though, is that what agencies tended to do, for example, was to like look at an application, and then they'd have someone fill out an application, for example, and then that would be how long it takes. Those are the time costs that they would estimate. The problem is if you have, for example, a 35-page application, it's not just the amount of time it takes you to like actually fill out the application, it's the amount of time and energy and financial costs that can go into actually being able to do that. And those are the kinds of things they said agencies had to account for. I'm going to kind of give you another example, another illustrative example. This is a woman who gave birth to premature twins, and she was encouraged by the social worker to apply for both SSI and Medicaid. It took her 8 weeks to get an appointment while her kids were still in the hospital to get an appointment with the agency to apply for SSI. She did do it. She went through the process, but the problem was after she did it, like a week or 2 weeks after, the hospital said that your child's going to be discharged within 48 hours, one of the twins. So what she understood was she had to go back and notify SSA that this twin was going to be at home because it was a change in status. She called up, she was told she couldn't get an appointment for another 4 months. And so doing what she was supposed to do, then she went all the way down to the office in Chicago, got there at 6:45 in the morning so she could be first in line because she had to be back at the hospital to care for her infants, and then tried to get this fixed. And it happened again with the second infant. So just context here, right? This is a woman with medically fragile infants who actually spent 6 months in the NICU. And just to simply report a change in status, she's running down to downtown Chicago. We might think, oh, it only takes a few minutes to update status, but that's the kind of cost I mean that agencies need to start accounting for. No, actually, that was a significantly more time sensitive cost. And this is just a screenshot from OIRA, kind of documenting for agencies what they should do in terms of documenting these costs. Okay, so let's think though about like what's the package of like, if we think about solutions, what are the packages of solutions we might have? The first way to think about this is sort of internally, like what can SSA do internally to think about reducing costs? And important to think about here, we want to think about beginning to end experience, which is language in that executive order, because they want folks to be thinking about like from the starting post, like how do people even know these programs exist, all the way through to things like redetermination in terms of ensuring you're still eligible once you're on the program. So in terms of outreach to beneficiary, this is what Seb's going to talk about. SSA has like a just a wealth of administrative data on hand to help think about reducing learning costs for beneficiaries who might be eligible. And they've already done some experimental work about how to do this, and that's really interesting and great. And I think we should see more of that. I certainly have some ideas about additional things that they could do, but that's one way to think about, very simple, straightforward way to reduce learning costs. I think the challenge with SSI, though, is that big picture, it's not really the learning costs that drive the kind of highest levels of administrative burden in this program. It's really the compliance costs. So internally, some ways to think about reducing burden is like looking at the application. Are there ways to reduce documentation requirements in terms of drawing on existing administrative data for different elements of that application process? Like, instead of asking people to bring in documentation, are there things that we could figure out how to draw on internally so people aren't required to do that? That's a super straightforward way. How about simplifying forms? I think one thing that's really important to keep in mind is that people enter the program, they're all eligible for the same program, but they're eligible under different conditions. And for example, if you're non-aged and need to prove disability, much more complicated process than if you're aged and the really main barrier to entry is like the asset requirement and the difficulties of documenting that. But you could imagine, for example, different pathways that produce a simpler and more straightforward application for aged beneficiaries than for what we know we need to document for non-aged disabled beneficiaries. The disability reevaluation process is extraordinarily burdensome for people. Just again, a couple of quotes here from people who've had experiences with this. This is someone with a child who has a genetic syndrome, now an adult child with a genetic syndrome. And here's how she talks about it. And you hear this a lot from people. Having to explain repeatedly that his situation has not gotten any better because he had a genetic reason for his disability was so frustrating. And people also talked about the difficulty of like repeating, for example, multiple hour-long IQ and psychological evaluation testing for like cognitive assessments. Cognition status isn't going to change. In fact, for most adults over time, that's not going to change. If anything, is of course, as we get older, we would lean more towards it declining. So I think there's parts of that process, the timing of it, what we're required to do, incredibly onerous processes. If there's anything we can do to think about reducing that, huge benefits. But again, I want to highlight too the issue about capacity at field offices. This is not a small issue. We can improve services by expanding internet capability services, and that's great. There's evidence that that actually can help for some people, but for other people, for older adults, for people in rural areas without broadband access, they're at a real disadvantage if their only ability to access services is online. That's a huge problem. And just generically, the kinds of hands-on help that people need to manage all this compliance costs oftentimes are like a person who can help you, which is what the field offices were supposed to do. The broader, aside from like thinking about internally of SSA to manage burden, we can also think like externally, sort of outsourcing in terms of providing help to people to access the program. And truthfully, programs like the Earned Income Tax Credit, for example, employ this strategy. There are free tax filing services that do a lot of outreach that provide hands-on assistance to people to apply for the EITC. So nothing's changing at the IRS. It's just simply that you have people in the community who help people navigate all that burden. So if you're thinking about like extreme approaches, like obviously I think we would think blended approaches, but extreme approaches, you can do nothing internally, but you can still help people a lot if you provide them with help externally with these sort of third parties. Community settings are the place oftentimes to do this. I do want to emphasize, I do not believe that this is an incredibly effective approach in terms of learning costs. It can help, but SSA actually has all the administrative data to have some sense about who might be eligible. So I think that's like, they have just amazing tools to think about reducing learning costs. In community settings, I think the bang for your buck here is actually like assistance. Hands-on assistance. And we see this in other programs. Medicaid, for example, hospitals do a ton of enrollment for Medicaid. And they hire people, and that's their primary task within the hospital, is to help people enroll in the program. And the reason that that's important is it's a difficult process. There's a lot of nuance to it. And so the people who can help the most are the people who are actually engaged in that process the most. So having someone in a community agency who doesn't really do this much, like maybe once every year they help someone, is not actually going to work very well. You really need people who this is like mostly what they're doing. Of course, we also need to think about incentives for those actors actually to do it. So the incentive for hospitals to get people enrolled in Medicaid is that they get reimbursed. And so, that's part of the path too, is thinking about what incentives are we giving these community agencies to deploy resources in this way to help people enroll in the program. The other way to think about this in terms of outreach is cross-program linkages. So the thing that SSI is actually so good at, and SSA is so good at, is linking two other programs from SSI. So right, if you enroll in SSI, and if you think about the story I told you at the beginning, and I have plenty of stories like this, people will often say, oh, enroll in SSI because that means you can get Medicaid. So it's a critical pathway to a lot of different programs, in part because the eligibility criteria are so strict. But it's not that you can't leverage these other programs in turn to access people who might actually be eligible for SSI. And there's a broad range of ways to think about doing that, from just sort of informally working with those agencies and kind of reminding them, like, you might want to think about encouraging people who might be eligible to apply, to more kinds of formal strategies like that are employed from SSI to these other programs. So that's big picture, a way to think about it. Okay, because I want to be able to move on to Seb here. The conclusion here is a couple of things. One, and these are super short term. Okay, so super short term, maybe to think about this in terms of recommendations, is sort of given the change in guidance around the Paperwork Reduction Act, for SSI, really better estimating the costs that people encounter when they're both trying to get on the program and when they need to stay on the program. I think that is really important and something that would be a very valuable exercise to do, in part because you can't really figure out how to reduce costs until you actually understand what those costs actually are for people. The second thing is, and Seb's going to be talking about some of this, but sort of testing possible interventions to improve applications and outreach. So I think there are honestly some low-hanging fruit that are kind of obvious places to target. But really actually getting in the field and kind of testing some key interventions that even can be super low cost interventions is, I think, another really sort of short-term fruitful strategy. Long term, I do think it's about, now that we have these executive orders, new guidance is coming out, that it would be really great if within SSI there was sort of an office that was focused perhaps on performance review. I don't know if this would be in the Office of Inspector General, that really was a key point, a sort of target point for more broadly thinking about this within the program, specifically around SSI. Of course, you could think about SSDI too, but we're focused on SSI today. But someone who is really focused on thinking systematically about how to act on these executive orders. So I will stop there. Thank you very much. And Seb.
Thank you, Pam. Let me just get things started on my end. So I can share the screen. Here we go. I assume everybody can see my slide deck now. If not, please say something. Okay, great. So first of all, thanks for having us here. It's a pleasure being here and giving this presentation today. And before I go into the line of argument that I want to provide in the next 10 to 15 minutes, I want to give two caveats. Number one, I'm not a social security expert at all. I'm a behavioral scientist who studied public management, and I've done research on access to services and programs, but my subject matter expertise is not in social security. Though I think there are some lessons learned from other domains that can be transferred to the social security setting, but I just want to caveat that. The second one as well is, as has been mentioned, I'm affiliated with the Office of Evaluation Sciences that sits in the General Services Administration, but everything I say today and my entire presentation I do in an academic capacity, and all information about projects they have been conducted that I provide today is information that is in the public sphere.
Thanks.
Okay.
We actually are having difficulty seeing your slides. So if we could just try that one more time. Sorry to interrupt.
No, that is great. It would be ridiculous if I give the presentation without. If I click on share screen, I click on share. Can you see it now?
So I'm seeing a blank white screen.
Yeah, it only gives me the opportunity to have when I click share screen, it says only whiteboard.
Okay. I can share your slides on your behalf in just advanced form and see if that works?
Yes, the slides that I emailed you. Okay, perfect. Thank you. And my apologies, like this is always happening live.
The permissions might be off, I suspect.
Yeah, I think that's the issue. Conway, let me know when you have them on.
We're good.
Perfect. Great. If you could go to the first slide, the overview slide. Okay, great. So the line of argument that I want to provide today. So I was asked to talk a little bit about behavioral insights, nudging, and the role of mailers, and how that relates with equity and access to social security services. So the line of argument that I want to provide today is that mailers are a great tool, as Pam said, they're low-hanging fruit to decrease learning costs that people experience in trying to apply for social security services. They can be combined with behavioral insights, so-called nudging strategies, but usually effect sizes that we have seen in the past are rather small to modest. So one of the arguments that I would like to provide here is like they're a good tool if you think in a short time to move some percentage points, but they're not systematic changes. Like auto enrollment would be where you get really like big changes in numbers for people that are enrolled. But I want to link that debate also to questions about equity and access, because I think potentially if we would be more targeted and more personalized in the interventions that we provide to individuals, we could potentially get higher percentage point changes. And I want to tie that into a conversation about a cultural change in the agency for the need for continuous refinement and testing and continuous testing of these types of interventions on different populations to get more bang for the buck, so to speak. Could you move on to the next slide, please? Great, thank you. So first, mailers that are sent out to people who are potentially eligible for social security services usually address an information deficit. So something that people do not know about the program. On the one side, they may not be aware of the program. They may not be aware of its existence. They may not be aware that they're eligible. They may not be aware that they're already eligible. They may wrongly assume they become eligible at a certain age threshold or certain age income threshold combination. And there may be misconceptions about the amount that people may receive. There could also be misinformation about program interactions. So there was a really nice comment in the chat about an individual who said that he or she assumed that they could not apply for SSI because it would interfere with their DI benefits being paid. So there is a type of misinformation out there that would kind of lead people to not apply for social security benefits. And another issue is, of course, communication around the benefits that you would receive. And that is linked to overall public communication about the solvency of the trust funds. If you look at research that has been conducted by Pew in 2018 among a representative sample of US adults not receiving retirement, 42% of US adults believe that Social Security won't have enough benefits for when they retire. So they assume they would receive no benefits at all. 42% of them assume they would receive reduced benefits. So of course, this is a very complicated matter, but point being is there is a certain level of belief about what you would receive when you would apply for SSI benefits, and that may have an impact on whether you apply for it or not apply for it. Mailers in this regard indeed are a good strategy to potentially reduce these type of information gaps. And I want to share one really good example that I think that was conducted by a team of researchers within the SSA in collaboration with the Office of Evaluation Sciences that is housed at the General Service Administration. So in September 2017, that team actually they identified it earlier, but they sent out mailer to a group of 400,000 potentially eligible or people who are potentially eligible to receive SSI, age 65 and 80. So they sent out 400,000 people among 4 million individuals. And what they basically find that sending out this mailer increased SSI awards by 340%. That's a very flashy number. In fact, that only means that from a baseline of 0.5 percentage points award, there was an increase to 2.3 percentage points, 2.3% uptake. In other words, that means it led to a 1.8 percentage points increase. That corresponds to 7,200 individuals additionally receiving Social Security Administration after 9 months. Social Security Administration benefits, my apologies, after 9 months, which is a great thing. But again, it's a modest effect, I would say. Could you please move on to the next slide? So next, I would like to examine a little bit the role that behavioral insights can play here in making these types of interventions more effective. So when I use the term behavioral insights, it's often interchangeably used with what is commonly referred to as nudging. And that goes back to writings of Rick Taylor and Cass Sunstein. They have a very influential book published in 2008, but version I'm citing here is from 9, that defines nudging as the choice architecture that alters individuals' behaviors in a predictable way without forbidding any options or significantly changing the economic incentives. So it basically means the decision environment in which individuals make choices is changed in such subtle ways that alters their behavior, but is not done so through bans or mandates, typical regulatory tools to change individual behavior. And it's also not done through economic incentives or disincentives, which is the neoclassical approach to change individual behaviors. This is not to say that bans and mandates and economic incentives wouldn't work. It's just the third soft way of altering individuals' behaviors in predictable ways. Some examples from other domains that have been used include the usage of descriptive norms. That is the use of information of what the majority of a group is doing, and the assumption that individual want to kind of go with the herd. Think about if you're in an elevator, everybody's staring to the left. Usually you feel extremely comfortable to stare to the right. So you will do what everybody else is doing. One very famous example comes from the area of tax compliance, where people who have been late in paying their taxes were sent emails, were sent letters. And these letters included a statement that said 80 to 90% or 90+% of individuals who are living in your tax code or in your zip code is paying taxes on time, right? And that simple descriptive norm substantially increased individual tax compliance. Other examples include, for example, making psychological ownership, so the intangible ownership about something that exists makes people more likely to act in desirable manners. We know from the lab, from lab experiments with regard to SNAP/food stamps, if people are communicated about food stamps as being their food stamps as opposed to food stamps more general, they have a higher propensity to go about and apply for them. Work that I've done in Germany with regard to the vaccine uptake or intentions to take up the vaccine, when we communicate about your vaccination instead of vaccination, people have a higher propensity to sign up for appointments, right? And another example of personalization or simplification of mailings. And there exist a lot of different examples here. I don't want to go through all of them, but I just want to give you a flavor of what we mean when we talk about behavioral insights. Again, behavioral insights have rather modest overall effects. A recent meta-analysis, so a meta-analysis is a study of studies, 126 randomized controlled trials that have been conducted using behavioral science insights in the United States by the two largest behavioral science units were summarized in that one study. These were RCTs that came from the Behavioral Insights team North America branch, and all the RCTs, or mostly all of the RCTs that the Office of Evaluation Sciences at the GSA have been conducted. 126 in total, spanning across 23 million individuals. And the bottom line is an average nudge has a 1.5 percentage point effect on take-up. That is an 8% increase over the average control condition. That's a fair change, but it is rather modest as well. Could you advance to the next slide, please? So in a nutshell, if you think about applying these insights to using mailers and or behavioral insights to increase Social Security uptake, then we have to say both methods, and they're not detached from each other, they're often used in combination with each other, can be effective. They're rather low-hanging fruits, but they also address different underlying mechanisms. So mailers are more about reducing learning costs and addressing information deficits, while behavioral insights encourage uptake, typically through various different psychological mechanisms, at times different psychological mechanisms. And both have small to modest effects. So seeing percentage points changes in the two-digit area is something that is rather uncommon in that space. In that recent study on the SSI take-up that has been conducted by Hameter and colleagues, there were various different letter variants that were sent out, but not a single behavioral insight inspired letter performed any better than the basic letter that had no behavioral insights in there. So at that specific point in time, for that specific population, behavioral insights were not more effective than just a basic reminder letter that increased take-up by close to 2 percentage points effects. But again, context matters, time matters. These were sent out in September 2017. We do not know whether that replicates today. The second point here is that we should bear in mind that when we talk about these effect sizes, we talk about average effects. We talk about the effects for the entire population of 4 million individuals that were the study population in that specific context. But behavioral insights and also meta interventions typically have so-called distributional effects. That basically means that there is what we call effect heterogeneity. So behavioral insights may be more effective for certain type of people than others. And we have they may have certain characteristics, like people that have a higher propensity to know about the program, they may be procrastinating, or people that are worse off in economic exchange relationship have a certain economic vulnerability. So there's differences in heterogeneity potentially among those groups. Can we move forward to the next slide, please? Right. And that brings me to the next issue about equity. From prior research, we know that access to social safety net programs in general and experience of burdens is typically stratified among different populations. So characteristics among which the stratification happens includes to resource scarcity, whether you have to worry where money for the next couple of weeks for you and your family is coming from is taking away time to think about navigating complex bureaucratic rules. Being in good health is another factor that stratifies the experience and the efficacy of burdens. And another one is age-related cognitive decline, obviously, because it's more difficult to navigate complex bureaucratic rules and apply for programs if you're really well equipped to understand these complicated rule setups in general. And all these different factors, they very often correlate with sociodemographics, race, ethnicity, to some extent gender and the intersection between race, ethnicity, and gender, obviously age, obviously income, level of formal education, right? And with this in mind, if we think about what type of interventions or what type of mailers should be used in the future, kind of as a low-hanging fruit, as Pam puts it, to improve take-up, then my argument would be to think about targeted and personalized interventions. So think about interventions to improve not take-up among the entire population, but identify certain vulnerable segments of the population, investigate what the underlying reasons for non-take-up are, and design letter, mailer, and behavioral insights interventions that speak specifically to these groups. There is very little work that has been done on that space in the social security and social safety net area, broadly speaking, but the propensity that you would get more bang for the buck in these contexts is rather high in my view. Yeah, if you think about targeted personalization, there's also a distinction between delivery and choice personalization, but I do not want to go into detail here, kind of as I see talking a little bit longer than the time that is allocated. Can you move forward, please, to the next slide? I'm jumping that as well. Yeah. So my final argument here, or my final point here, is that there is a need for a cultural change, for continuous refinement and testing of low-hanging fruit or kind of interventions in the mailer and behavioral insight space, and a combination of both to target the specific types of groups where we get the highest bang for the buck. That requires a culture, and I would like to use the analogy of Amazon, of A/B testing and user tests. Think about the website of Amazon, which is their main business model, where you spend time, browse through programs, and then click in order to make a purchase. It is as user-friendly as possible, but they're running constant behind-the-scenes A/B tests, where they change small elements of the website to make sure you spend more time, and ultimately you spend more money on it. And that, like a one-to-one similar approach in the social security space may not be possible, but I think a similar application of a mindset that these type of studies would be repeated regularly on new populations in a new point in time, like, for example, communication about the trust funds is changing year to year. Public opinion is changing. Generational shifts are happening. In the study from 2017 that I presented to you on the mailer uptake that worked back then, we do not know if it still works today. So I think there is a good argument to have these type of interventions, make them more personalized, make them more targeted, but continuously retest their efficacy and make small changes to it. That, of course, goes hand in hand with recent developments in the federal space around the Evidence Act. And I was particularly surprised, that's the wrong word, particularly pleased, when I saw Social Security's evidence officer today, also among the list of participants. So I think kind of like there is a debate here of whether these type of tests and these type of changes could play a potential role in Social Security's learning agendas and evaluation plans, not as a single study to produce definitive evidence, but as a cultural change where there's a continuous need to refine and reevaluate evidence on targeted interventions that hopefully improve the lives of people who are eligible to receive Social Security services. Could you move on to my next slide, please? That's it. Thanks a lot for your time.
Thank you, Seb. I'll turn it over to the board.
And hi, Conway. This is Bob. And now it's time for board members who may have questions for our panelists.
Bob, I'm happy to start. Hi, this is Nancy Altman. Thank you both. This was a really informative presentation. My question may take us in a slightly different direction, and it's a little bit more of a comment, but I'd love to have, especially Professor Hurd, but both of your reactions to it. And that is that when you talk about burdens, not just information, but burdens once someone wants to apply and the length of and complexity of applications and so forth, it strikes me that there's an ideological component to that, that some of the complexity is a result of legislation, and that, of course, the agency has to either get a legislative change or just go with. And some of it, where there is some discretion in the agency, sometimes they introduce complexity there. And it strikes me that some of that is result of what your goal is. To the extent you're concerned that you want to make sure no one who is, as few people as possible who are not eligible don't somehow get on, then you're going to have a lot of complexity. And if your goal is to try to get as high an uptake of people who are eligible to apply, you're going to have you're going to try to reduce the barriers. And that's not usually made explicit, but it strikes me that that is a key part of some of the complexity in these programs.
I think that's right. The funny thing is, so taking a step back and thinking about this, right? Like, I do think we have this sort of sense, and just there's places where this is true, right? Like, you add complexity, you reduce the risk of fraud. The reverse is actually true too. So what's funny is the retirement part of the program, right? When they were implementing it, and Nancy probably knows the story already, but like when they were implementing this, right? The logic was, or one idea was, you'd have a stamp book and people would put stamps in from their employers to like basically justify the eligibility. And and I believe they were doing that in Europe at the time, that's where that came from. But one of the reasons why they built this like huge administrative system, right, was because actually people were quite worried, at least from what's documented, what I found is that people were worried about fraud. So the system that they designed is, shifts more of the burden on the state, right? But it both led to a program that does not have significant fraud, but on the retirement side is actually the best and most accessible program we have, actually. So I think it is, as broader context, I think that's important to take into account. More specifically, though, right now, what I would say is that the executive orders from the Biden administration are effectively pushing agencies to take this into account in their cost-benefit analysis. So you can't just keep thinking about who am I keeping out who shouldn't be on the program. You do actually have to start considering these burdens and building them into your cost benefit analyses. And I do believe that that's part of the justification for the kind of new, the new advisories around how to interpret the Paperwork Reduction Act. So I do think there's room here to kind of push the needle a little bit. And to be fair, I do think this really matters. Like, I think if you look at UI, for example, some states were putting burdens around UI into place because they, like Florida, like they wanted to spend less on the program. But in other cases, they were actually being really pushed by the federal government to reduce fraud and abuse, to reduce overpayments and things like that. and getting a lot of pressure on them to do that. So it does come from the top down. And I do feel like part of what these executive orders are signaling in a very concrete way is that agencies can think differently, actually, and think more about these other kinds of costs as well. Or that's how I'd like to interpret it.
Thank you.
Other members? Well, I'll jump in. One of the things that what you just said implied to me is that the government could do a better job in more quickly evaluating its success in reaching only eligible folks. In other words, the efficiency of their decision-making process. And it's such a complicated decision-making process already, as you know. And have you given any thought to the burdens of evaluation, essentially, of making sure that the agency can turn around to the public and say, we very quickly are able to determine if we made a mistake or if there's fraud involved, and to do that in a way that also alerts people who, for example, may have received an overpayment, then they didn't really understand that they were receiving an overpayment and then end up with a big bill down the road. Has that gone into any of your thinking?
So right here, part of the issue, if I could step back, part of the issue really is about like administrative capacity to do this. And this is why I made that point at the front. So when I say that, it doesn't mean that I don't think that they're like, it's not like SSA can't do anything right now. I don't mean that, but I also want to always contextualize this when we talk about these kind of problems, that they are resource constrained. And so for them to reduce these kinds of burdens, like they need resources to do this. The point about, if I'm following up here, the point about, something like overpayments. Within the agency, there do need to be, I think, as Seb was, if I'm following your question properly, I think as Seb was implying, there does need to be some kind of constant reevaluation to kind of figure out what these problems are before you can address them. But I feel like I'm not fully answering your question.
Well, we had our board members had a conversation earlier about overpayments and the fact that there are many beneficiaries who may receive overpayments without understanding it, and that there's a time delay administratively in terms of determining an overpayment and then getting the word out and addressing it. So when I think about put this way, that someone who interacts with Social Security Administration feels that they're getting a fair shake, that they're getting good information, and that problems can be resolved rapidly, rather than it being you're defrauding us, we're going to slap you now type of approach. I'm wondering if that figures into administrative factors.
Yeah, absolutely. Right. And actually, so I'm sure I'm wondering if this discussion was precipitated by the article this morning in the Washington Post about overpayments and what's happened. So interestingly enough, the story I told you about the mother with twins in the NICU, part of that story was that she ended up getting payments she wasn't supposed to. She knew it, and so kept cataloging them, like she wasn't cashing the checks basically, but it took her about 6 months to get the agency to stop with the payments. And this is why I guess I'm going back again to the capacity issue. So this is it's an enormous burden, right? It's both financial in terms of if you do spend that money when you didn't realize you weren't supposed to, like it's a learning cost of knowing it. And then it's like on her part, like it took her so much time and energy to just get them to stop doing it, right? So it's a huge deal. It's hard to imagine. On some level, the thing that I think is most scary about it for SSI is that these are folks who by definition, are incredibly poor. And so the potential to even repay that if the agency makes that mistake, it's just, oh my gosh, it's hard to overestimate that burden. So as I was talking to her about this experience, I mean, you know, there are some sort of simple things like, why isn't there a process where she could have called, as opposed, like, again, she was trucking down to the field office because she couldn't get anyone to engage with her over the phone about it. She had no case number, for example. So it was like reinventing the wheel every time she spoke with the agency. I do think, I want to be careful here because this is like not, like I'm not so much in the weeds on this, but based on what we understand about what's gone on, this is certainly an area where you could have kind of a close look at what these processes are. And if there aren't ways to sort of expedite, as you're pointing out, God, at the bare minimum, people who realize they're getting payments they shouldn't, let alone the people who don't realize, and how quickly you notify them, and what kind of information you give them about how to navigate that process once it happens. I mean, if you were to ask me, I mean, my kind of view on this, it's the agency making the mistake. I mean, I know this point about statute, but I don't understand why we push this burden back onto people. The agency makes the mistake. We have to absorb those costs if we make the mistake. But that's a sort of, that might be a little Pollyannish in this environment, but that would sort of be my take on it.
In a similar vein, a question for Seb. In the nudge category, it seems to me that there's been a lot of market research about since America is very good at advertising, as we know, about what people respond to certain things, and the reports I'm thinking about are the exact same product can be promoted through different words, and different types of people respond to those words, even though it's the same product. And so I know you're not a Social Security expert, but in this area, is there an opportunity to tailor the message that Social Security has to different demographic groups, political groups, whatever?
Yeah, thank you. Yeah, absolutely. I think I think like there needs to be like the first step, there needs to be a really good understanding of how we segment our consumers, like who are the people that we want to speak to, and what are their main concerns, like, and on that basis, like what are the messages they are most amenable towards. But yeah, what I mentioned like during my talk, like the concept of psychological ownership, if we talk about people get the vaccination versus get your vaccination, like that makes a difference. In the area of benefits, Social Security benefits, I do not know. It probably may make a difference for some groups, but then again, like we're talking about some percentage points, and they have significance for sure, but it's like not the big change then. But yeah, so what I'm trying to say is kind of there would need to be a team maybe within the SSA or kind of researchers really kind of thinks hard about how we segment the group of eligible users, what differentiates them, what is the main reason for them not taking up SSI, and what kind of messaging they're amenable to today, and then retest that again in 3 or 4 years, because the policy environment, the communication and everything, that is changing over the years, right? But yeah, I hope that answered your question, Bob.
Yes, thank you. I see I have a question from Kim.
Yes, thanks, Bob. I was curious, Pamela, your experience or whether you've seen other agencies handle this well, kind of as a best practice. But I know in the past, as in my prior life and through the board, when we've talked about simplification, to make things more understandable, little did we know we were addressing administrative burden at that time, but over, and clearly now, but over the years, Social Security has said, well, our lawyers tell us we have to have this. These are statutory requirements and we have to do these. So I'm just wondering, in your experience, have you seen any good examples of ways to address that, or ways that agencies are addressing that either at the state or federal level?
Yeah, so this is a really good point. The number of times when you see a burden and someone says, well, because the lawyer said, or when you're trying to reduce burdens, like sharing data, sharing administrative data across agencies because the lawyer said, I mean, you are pointing to, honestly, what I have come to understand as being one of the most significant problems we have in terms of reducing burdens is I'm sorry if there's lawyers on the phone here, but is the lawyers, and the degree to which, yeah, I think that's a huge problem. Now, that said, I want to make 2 points. One, the executive orders are clear that agencies are required to be thinking about, measuring, and in any ways they can, trying to reduce this stuff, regardless of whether they are statutory, organizational, or rule requirements. So, and I think there are always ways, like, you know, you're required to document assets, okay? So I think it's really worth looking back and, yeah, but how? That would be one example. And I do think, actually, what's interesting is if you look at, for example, the SNAP program over time, or Medicaid, for example, they've been actually fairly aggressive, both at the federal level and then in some states more than others, really aggressively implementing changes that reduce burdens, but still clearly fall within statutory and rule requirements. So I hear that, and I absolutely know it's a problem. I absolutely do know that there is always room. The question is where. And I do think the first kind of low-hanging fruit, and this is sort of why I started with, like, let's document it, because does the agency actually fully understand the burdens embedded in SSI and that application process? As the new executive order and the new rules around the Paperwork Reduction Act, or the guidance around the Paperwork Reduction Act, are implying. I would like to think that the needle is shifted a little bit with those executive orders and the guidance around the rules in terms of what the agencies can do.
Great, thank you.
Yeah.
I believe we had a staff question. No?
There's only one from the public I can interject with at this point. We have one question from Sarah Lynch at Community Legal Services of Philadelphia, an organization that provides direct service work. And her question is, what are the interventions to identify and reduce the significant psychological burdens for people applying for SSI? Particularly thinking for people who are non-aged and applying for SSI with severe impairments grounded in trauma. Going through the process can bring up trauma, and often they're denied many times. So if you could, those points that Sarah mentioned, thanks.
Yeah, one thing I didn't say, which I really want to note, is that both the executive order around customer service, but in particular the rule guidance around the Paperwork Reduction Act, actually make explicit the agencies are required to think about this. They are actually required to think about the psychological costs. And that's really new. Like, that is actually really new and really important for the reason I think that the person raising the question is talking about. So are there specific interventions? I mean, Sab talked a little bit about sort of generically, more writ large, I think really more around deservingness frames, like how do people feel like they deserve a benefit or not? But the question asked, I think is much more specific, and I do think is highly relevant for SSI. So when the stories I was telling earlier, but you hear this all the time for either people with disabilities or family members applying for people with disabilities, is just how painful, actually, the process is in a feeling psychological kind of way. So people will talk about, for people with permanent disabilities, like, how many times do I have to keep telling you, like, the genetic syndrome isn't going to change. She's not going to magically acquire a few new genes and everything's going to be improved. So I do think that, I actually think that part of the key in terms of thinking about intervention is, how many times do we really have to require people to provide the same information? It's a really basic thing, but that's what you're seeing people questioning, like in the redetermination process, like, how many times do we have to keep giving you the exact same information that will not change from year to year, let alone in 10 years? So I think as an intervention, that's the place to start targeting and really thinking about, like, are there ways that we can really think about altering some of those practices, because they are really painful for people, actually. And it's hard to overstate that when you talk to people and engage with people about this.
Well, that raises a similar question in my mind, because having worked with many people who've applied for services, I hear the fear factor becomes very significant. And in some ways, I think it's built in when you have a system that is constantly watching out to make sure you don't do anything wrong, and there's essentially a penalty for doing that. There's going to be fear attached to it. And if we're concerned on the other end with people not having negative experiences, it seems that in some ways it's built into the system to create a certain level of anxiety. So I'm just wondering how you balance those factors.
Yeah, I mean, again, like sticking with SSI, right? Like, the people who are applying for this, there actually was someone in the comments who was sort of talking about this, one of the questions, and was sort of saying, effectively, like, this is kind of life and death for me, right? And so inherently, it's scary, because you need these benefits to survive. You need these benefits, the pass through to Medicaid eligibility in many states to access healthcare. And so, right, it is hard at base. Like, this is just going to be there at base, given how significant the consequences are. I think the issue is, this is like where time costs come into play, right? As a part of compliance costs. How long do you push people in that sustained state of fear? If it takes a year to access a benefit, if it takes, as my one example, the woman who called her congressman, which I don't think is that unusual. I think the goal is basically to reduce the time period in which people have that stress and that fear and that anxiety. And actually, in the health literature, what you actually do systematically find, what's harmful for people's health is not like acute stresses, like a momentary stress. It's that kind of chronic stress. And arguably, what we built into processes, if it really takes this long for some of these things to play out, is like additional sustained stress in people's lives who already have enormous amounts of stress. So I guess that's sort of how I'd answer that.
I see a question from staff member Jen.
Hi, this question is for Seb. So I'm assuming that nudging, it's not just the messaging, but the timing of the message that matters. And I'm wondering specifically about redeterminations and continuing disability reviews and those kinds of administrative steps that occur basically after a person is found eligible, sometimes years after. This might be setting you up a little bit, and for that I apologize, but do you have any reactions to if a person goes through that process of eligibility and then is basically needs to be primed for having to prove that again later? What would a nudge in that space look like? What would be ideal timing for that kind of nudge, for just to prepare people for the reality coming to them?
Yeah, I just mean, first of all, yeah, you're absolutely right. Like it is not just a message, it can also kind of have an effect on the different timing, especially kind of like you can be kind of just in the process of getting your services, you can be a very fresh awardee or benefits recipient, and it could be like in a 2-year, 3-year journey. I just mean, I remember the one thing I know about Ticket to Work, like if you are an awardee, within your first year, you get a letter asking or kind of proposing to consider the Ticket to Work program. Like for somebody who just got their DI, it's a little bit, it's a
Yeah,
little bit
the
funny.
timing of those early notices was
Yeah, not an
unfortunate.
expert in that area, but like it strikes me as a little bit funny. But yeah, you're right. I cannot think about something at the moment because what I'm trying to say is like every underlying mechanism is special. There's not a one size fits all solution nudge, unfortunately. Otherwise, we would have a silver bullet and we could apply it to every human behavior and we would be better off or worse off, depending on who is using it and for what it means. But I completely agree with you with the broad strokes. And again, I think we would need to look at the specific process. We would need to examine it. We need to think, what is the underlying motivation for individuals here? What is the choice context in which decisions are made? And does it make sense or not? But the answer to your question is yes, timing matters and we should take it into account. But I can unfortunately not give very specific recommendation at the moment in the absence of having the full contextual knowledge about that situation.
I completely understand. And the redetermination process confuses some of us who have been involved in it for a long time, so completely get that. If I may take just another second and see if Pam has any thoughts on my question.
I think Seb answered it well.
You know, one other question, Bob, that if I can jump in, that I have is that it appears, and again, this is anecdotal, but that if you're applying for multiple benefits from multiple agencies, you may have to give the same information over and over again, or there might be information that's, you know, for sometimes people need earning verification statements, and that might already be there, but they, instead of being able to transfer it to HUD, if HUD's the one that needs it, you have to go to the office, get it, then take it to HUD. Do you have anything? I assume that would be an area that there could be a lot of simplification, that it might be a little bit more complicated for the government, but and that's really in some ways back to the using the stamps. I mean, fraud was an issue, but it was also who has the burden? Is it the government thing, or do you have to keep the stamps? Part of the issue there was people lose stamps. So some of it has to do with size of government too, and that ideological fight about, but any thoughts or comments you have about that?
Maybe I can give a very, very short reaction and then give it over to Pam because she's the expert here. But me, as you hear from my accent, I'm a non-native speaker. I'm originally from Germany. And
yes,
Germany,
we love Germany, started all of social insurance.
I wouldn't say that, but at least you're right. Like a lot of, yeah, exactly. A lot of the burdens are capped by the state.
Yes.
Right. And they're not put on the individual. So there are models for that. And I'm going to step back here and hand it over to Pam.
Yeah, I mean, this is a huge thing. There's absolutely, and there is some information sharing that goes on, right? But that is one of the most substantial ways you can reduce burden. And that's like the slide I had about the linkages between these different
yes.
programs, right? Like, and that's part of what happens is that there's information sharing behind the scenes. That's sort of where the burden's shifted to the state rather than the individual. The challenge and the executive order around customer service definitely pushes on this, like that we should be doing more of that. And I think some of the challenges when you talk to people about it are, again, dealing with statutory data sharing issues, things like that. So that, I think that's, so I say that not to say, oh, it means we can't do it. I say that to say, like, that's the place we need to target in terms of thinking about how do we address this problem. Part of the addressing the problem will be navigating different statutory requirements, negotiating between agencies, and actually really getting agencies on board to like want to do this, right? Like there's a version where agencies like literally can't, and then there's a version where agencies kind of resist doing it. So I think sort of both like dealing with kinds of those issues. And again, going back to the executive order, I feel like I keep hammering this point home, maybe overdoing it a bit, but it really does matter, right? Like when the feds, when the executive branch, when the head of the executive branch sort of sets a goal and says, this is something effectively we want to start working on achieving, you do sort of hope it gives people within agencies who share these goals more tools to actually push even within agencies to do things on this front, including sharing data.
That's helpful. I mean, I think maybe another aspect also is IT, and it involves IT modernization, that the computers can't speak to each other. It's complicated to transfer.
Yeah, but those are fixable, right? Like these are fixable solutions. Actually, and seriously, in part because part of what's happened over the last, since the ACA, since the sort of initial disaster of the website, they have gradually brought in, we work with people from Code for America, for example, you know, that presence, that sort of digital presence, and people with real expertise in these areas were actually involved in designing the executive order, and are much more involved now than they were prior to the Obama administration. So I actually think increasingly we would have capacity to do those things too in the federal government.
Well, in fact, you're raising in my mind a really good example, and that was the getting rapid tests. Getting the COVID rapid tests, all you had to do is put in your address and it showed up at your door. I mean, it was as simple as it could. I mean, assuming you had access to a computer, you know, it's not the entire population, but if you had a stable residence and you had access to a computer, it was amazingly simple.
That was the Office of Digital Services. Yeah, which was created as a function of the ACA. Problematic growth. Yeah. ACA keeps on giving.
Another really good example is there is a team of digital engineers within Veteran Affairs, which works on question on recertification and trying to build data linkages into their services. So if you have been employed to war and you come back with some kind of condition, then you get cash benefits, so you get kind of benefits, but you need to recertify every year. But recertification that you're still suffering from cancer while you're undergoing that type of treatment, for example, is rather burdensome. So being an integrated healthcare system, they have that information available. They just need to create these cross data linkages. I assume it is much more difficult when you go outside the military or the veteran system, but nevertheless, like, data is available. It's just like having more civic tech engineers and human-centered design people within the government to work on these type of solutions. Because if civic tech people can figure out who's eligible for SNAP or other type of services within certain states, government folks can do that as well.
You know, one of the things that this conversation reminds me is that anytime human beings interact with one another, you can come away from that interaction feeling good or bad or neutral. And so it isn't, this isn't a new idea. And one of the things I wanted to ask about was the interaction of how staff interact, people who are in this administrative process. I mean, you know, Social Security is complex. There's federal offices, there's state offices, there's regional offices, et cetera. And there's a lot of, and there's labor management, et cetera, et cetera. And it seems to me that if internally you have systems that seem to recognize human emotions and reactions to how they're treated, that's going to benefit downstream to how people are reflective of how what they do affects beneficiaries or applicants.
I mean, and this is, sorry, couldn't do it again, the executive order. But they actually, they specifically talk about trust in government as being one of the key reasons why you need to start doing this, right? So like when I talk to people, in my case, I was mostly talking to parents of children with disabilities, but right, like SSI and Medicaid are so profoundly important for these populations, right? And when they get them and when they stay on them, they're literally life-saving. But their experiences with those administrative systems are so bad, people end up with just this like terrible taste in their mouth. And so it's damaging, like that is damaging in a lot of ways. Like it's damaging in terms of sort of our generic trust and belief in government. It's damaging to SSA as an agency in terms of its ability to garner support for itself. It is really damaging. And so that is one of the things I think I really appreciate about the way the Biden administration has approached this, is just really recognizing like these interactions really matter. And we undermine these huge investments we make when we don't take them into account. We really undermined these incredibly beneficial things we're doing.
I just mean from a larger perspective, one could say kind of that government interaction in the past has always been kind of characterized by an outcome focus. So kind of like you have interactions and what is the result in the end? But we know from a lot of research, especially among areas, an area called procedural justice, is that, for example, outcomes of the court, even if they're not for your own benefit, you're much more likely to accept them if you perceive the process itself as being just and fair, right? So it's not only about outcomes, it's also about processes. Like if I give my students, and I hope nobody's watching and gonna learn about my approach, but I try to show them transparently what are the steps I take to come up with a grade, and I want to treat them respectful and fair. But so at the end, if they get a poor grade, they do know where this comes from, right? And they understand the process behind it. And I think the same is with government interactions. Like the process has to be fair, has to be just, but it also should be transparent. It should not be within a black box. So even when we order something at Starbucks, we can see where the order is at the moment. Or if you order something at Grubhub or one of the other, want to use one specific one, you can see where the order is at the moment, what is going on in the process. Like, but if you apply for benefits, you apply for it, it's in a black box. And at some point you see the outcome, right? So, but yeah, I think there's a lot of room for proceduralization. If that is a word, substantiation is a very German thing, but yeah.
Well, it seems like those considerations do apply to organizational issues in terms of how people interact who are working for Social Security or a state office that does that. The culture. It seems to me that if you work in a culture where you don't know what's going on, where you don't get direct feedback, where your supervisor doesn't treat you well, whatever it might be, that creates a culture that can turn around in terms of how a worker might treat a member of the public. I'm just thinking that these considerations both apply internally and externally, and how those two interact.
Exactly. Like as a public management scholar, for me, culture to some extent is a function of the structure. So kind of what are the performance incentives and the performance regime within which caseworkers and street level bureaucrats, those who are interacting with the public, operate? Like, is the goal to process a minimum of X cases a day, right? Then you rush through case through case through case. Is the reduction the number, or is kind of the goal kind of like every individual you interact with being satisfied with that interaction, which is a procedural outcome in itself, right? So it's about how you structure the rules and the incentives in organizations where individuals operate and interact with the people they serve. In my own experience as a public management scholar, like frontline workers are incredibly pro-socially driven and they want to make a difference and kind of help the clients they work with, but they're confined by the boundary, by the regulatory iron cage in which they operate typically, right? So yeah, to me, this is mainly an organizational problem. And another thing I want to bring up as well, what is really important in these interactions is representation. Many of these vulnerable populations, they come from certain segments, also certain socio-demographic segments of society, and they deal with caseworkers who do not have the same lived experiences as a similar demographics than they have and do not have shared values and to some extent maybe shared experiences. And that often kind of also can result in suboptimal interactions. So I think, and talking about executive orders, like the Equity EO certainly rings a bell here, that delivery of public service and programs should be done in an equitable manner, and that also includes representation at the caseworker and interactional level for folks from these backgrounds.
Thank you. We're about 6 minutes out. I want to make sure if there's any additional questions from board members, staff, or public. Conway, are there?
Yeah, I still have some questions I can ask. That is engaged. We had one question about targeted digital outreach. Sometimes social media might be one way to address learning costs. But has anyone looked at the relative advantages of targeted digital outreach to different demographic groups or at-risk populations, and are certain barriers to consider? And I'll throw one other question out at the same time. We have another question asking about other countries for models. Any other different US programs? Are there any other models in other countries that we can consider? So digital outreach and other country comparisons.
So I can talk about the targeted digital, and I leave the other country comparisons to Pam, who's more the social policy expert than I am by far. In terms of targeted digital outreach, so I'm not an expert in that as well. I've done an RCT with Facebook users, one in a completely different area. I think what social media companies and advertising companies can do, the government should be able to do as well in an environment where we do not consider statutory and entire kind of legal framework. As not being a lawyer, I'm not aware of. I think kind of targeting people in certain neighborhoods with certain type of messaging, that should be possible. You can target zip code level on social media. You have information about gender, and you can purchase additional data points to learn about individuals. That's why we get the type of information. Like I go to a certain website at one point and then it tracks me and they know a ton about me. I get all the time advice how people older than 40 make investment decisions these days. I just turned 40 a year ago. Like haven't received this type of information earlier. I think like similar type of information, as long as it's within the legal confinements and the ethical confinements, I haven't thought about that a lot, and that would require some thought here. This is possible. To my knowledge, this would be a frontier. Not a lot has been done here, but this is something that should not be a frontier, because this is how we
It's
reach
interesting.
a lot
We
of
also, just to mention, we also received one other question that I think is along the similar lines. Regarding personalization and targeting mailers, how can one actually do that without bordering on possible issues like gender, racial group, and bias stereotyping? Many government agencies like to keep their information vague as to keep it fair across the board. And so I think that question also kind of relates to the same.
I've thought about that. Yeah, I thought about that. I think this is a really good question. I think we need to start at a different point here. Like burdens are experienced not homogeneously. I, as a white male with a PhD, I experience different type of burdens than a young woman of color with multiple kids who's a single mom, right? So like the experience of burden is a different one for each of us. But if we treat all of us the same way, that would be inherently unfair. Like I do not need somebody who kind of provides me assistance for applying to certain government benefits, just my opinion. I think I can figure that out. I have university education, I have the intellectual capital, and I have the time. Like I do not need to do 3 jobs at the same time. And this is a complete stereotype that I'm drawing on. There are many intersections in between here, but multiple kids, multiple jobs, just simply going to the principal and getting a statement that your kid is your dependent, so you can show it for EITC purposes in case you're getting audited, is a huge effort. Right? So, and then interaction with authorities. I feel confident interacting with authorities. I'm very Germanic. If you're not respectful to me, I ask to talk to the supervisor. Not everybody is like that, right? So I think we need to. So I think like treating us all the same is actually not ethical and is unfair. At the same time, we should be very that we don't fall into kind of stereotypical traps, and that doesn't kind of lead to a reproduction of inequalities or discriminatory processes. But I think targetization or target beneficiaries is the fairer approach. And it's actually in line with the Equity EO, which specifically says we need to identify these different inequities that different marginalized groups experience when trying to access government services and programs. And the logical consequence is, of course, those who have bigger problems, they need to be helped. But this is a normative question. Should everybody be helped the same, or those with the biggest problems, right? I take a stance here because I don't represent the government, but yeah.
I just sort of tag on real quick about this. We do need to be very careful about web-based intervention. Like there's been a big shift to push services to the web. And there is evidence that for some people that increases access, and for others, it actually reduces access. Particularly rural areas that lack internet access, older adults, which, you know, it's not a small fraction of the SSA pool. So you need to be very, very careful about those sort of interventions and really think about it as a package. There's a broad array of beneficiaries. They're going to need help accessing in different ways. There isn't a single solution.
Well, we're coming up on our time. If I can indulge you just really quickly, what is one thing that you would suggest that SSA do to improve its access? One thing, very simply.
I would say auto-enrollment.
Well, right. I mean, eliminate the asset test.
Whatever.
No. I would actually say I actually am going to start small here. I actually think what needs to happen is SSA needs to act on this executive order and put someone within the agency. Someone suggested that Senators Wyden, Brown, and Lee and Larson are working on a beneficiary advocate office. That's certainly not that's a start, but you actually need someone within the agency who's focused on performance, who like basically this is their job to think about how to react to this executive order, including the very first step is better documenting the burdens, particularly in SSI. They're not actually well documented by the agency, at least in terms of how the new guidance around the Paperwork Reduction Act is written. So that sounds very small and in the weeds and bureaucratic, but I actually think that's the place to start.
Great. And you said, but you've said what you have to say.
I did, yeah. I just mean I defer to the expert here. What Pam said makes a lot of sense, and like the biggest change I would be in favor would be auto enrollment, but this is something that seems to be not on the table.
I agree with auto enrollment too, actually, but you need to ditch the asset requirement before you can do that.
I'll take care of that. Well, I want to thank you both again for this very important discussion. I know there's a lot more to be discussed, and I want to thank all of our participants for joining us today. Before we sign off, I want to remind the audience that we welcome your feedback on today's event from both the logistics and to the content. Please let us know your thoughts by mailing us at events@ssab.gov. And with that, I want to thank you again and wish you all a safe and enjoyable weekend. Take care now.
Thank you. It was a great.
Thank you so much.
Being here.
Yeah.
Thank you. Bye-bye.
Bye-bye.